Okay, we're back, we're live, we're here. It must be Tuesday because it's Hawaii, the state of health, the state of best health in the country. We work hard, and the State Department of Health works hard, to make sure that we are a healthy state. So today we're going to talk about health in the home environment, okay? Because, that's where people can get sick too. And we want to, get them where they live in their personal habits and risks and exposures and whatnot. Very important. And our special guests are Blythe Nett. She handles the asthma side of things. Do a deep breathing for me, Blythe.
A deep.
Blythe Nett. And Jill Tamashiro, she's on the tobacco side of things. Take a smoke.
Oh, I probably should.
I can't do that. This is a family show.
Yeah.
Okay, so the idea is that the Department of Health is a really big department. It has lots of functionality, and with the help of the Department of Health and Ginny Pressler and Miley here, who's sitting in the back in our gallery, we covering the various offices and functions of the State Department of Health and finding out that they really work hard to keep us healthy, which has got to be one of the reasons we are a healthy state. And so today we're going to talk about this particular thing, that is healthy home environment, and see what the Department of Health is doing for you. Okay, or at least would like to do for you if you're cooperative. Okay, so my first question is: both you guys seem to relate to respiratory issues. How much respiratory issue do we have in Hawaii? Is Hawaii got a respiratory issue of concern? Is that why we are so focused on it?
So for asthma, which is what I work on, there's about 127,000 people in the state who have current asthma, which is about 1 in every 11 adults and 1 in every 8 children. So about a fourth of the people who have asthma are children. It tends to affect young children more than those of us who are adults. And what the consequences of this can be healthcare costs, like when they go if people go to the emergency room, if they're hospitalized, it can cost a lot of money. And then kids are missing school, adults are missing work. And then people just don't feel very good, and it's sort of hard to live your life every day.
If you can't breathe right,
you can't breathe
not
well.
going to feel good. It's just a matter of getting oxygen into your body. So what is asthma?
So as you said, it's a respiratory disease. It affects your airways. And I'm not a medical doctor, so I'm not going to give a very detailed explanation, but basically what happens is your airways constrict, and sometimes there's mucus that's produced, which
Inflammation. Inflammation is not helpful.
No, it's not helpful, and like you said, makes it difficult to breathe. So the tighter it gets, the worse it becomes, and then you can have people in the emergency room
Can't breathe. Which could actually kill you.
It could.
If you can't.
I mean, fortunately, the number of people who die due to asthma is not a huge, big problem. But again, it's the other things that can affect you before you get there, right?
Okay,
the feeling miserable.
The question, Blythe, is how does this happen? I mean, chemically, or by some kind of pathogen?
Well, I mean, there's probably a genetic component to it, but the truth is that there's nothing. We can't really pinpoint one cause. So we work in chronic disease, and a lot of what we do is maybe prevention, and you can't really prevent asthma. Nor can you cure it. Once you have it, it's a chronic disease. You're going to have it probably for your entire life. But what we try to tell people, what we try to work with people on doing, is to manage it. So seeing a doctor regularly, getting to know what their particular triggers are, taking the medication they need, things like that.
We just got a tweet in. Justin Baptiste, he was on the show not too long ago. With Paul Jackson. He says, much mahalo to ThinkTech for having me again for the NBA playoffs just an hour ago. Breakdown, part 2. Much love to Paul Jackson. And we got a photograph here. So let's keep sending those tweets, okay? If you want to send a tweet, it's at ThinkTech Hi, H-I. Okay, there it is on the screen. And we want your tweets. We want to engage with you. We want to hear what you have to say. And you may have a tweet where you're asking Blythe Nett or Jill Tamashiro a question about asthma or about tobacco, and we'd be happy to require them to answer. Okay, there's one. Here it is. Derek Saratari He gave us a tweet. Much mahalo to ThinkTech for having me again for the NBA playoffs breakdown. Much love to Paul. He's a popular guy, Paul Jackson, isn't he? Okay, so I want to go back to that. I mean, I've always wondered whether Hawaii has a higher incident of asthma than other places. Do you know?
We do. We're probably in the top quarter or so of all the states. And so our program is actually funded by the CDC, and not all the states in the country have funded asthma programs. We're one of about 20. And I think part of the reason is that we do have a higher prevalence. We do have a unique situation living near a volcano, which tends to...
I think it's the air.
Yeah, which tends to cause problems for a lot of people.
What about
So yes.
spores?
Spores?
Spores.
Well, mold can be a trigger. And I think one of the things we were going to talk about is, especially in people's homes, that mold is often a big problem, especially if you live somewhere that's sort of rainy and moist.
All right, we're going to talk about that later.
Okay.
I want to introduce Jill.
Yeah.
Okay, Jill, you're the tobacco lady.
Well,
Did you ever smoke when you were a kid?
No.
You never once?
never,
How about
no.
you, Blythe?
No.
Good.
Well, I have asthma,
That's
so
correct
not a good
answer.
idea.
So, what about tobacco? Tell us about tobacco. I thought everybody gave it up already. It's finished. No?
Well, so actually my specialty in the tobacco program is secondhand smoke. So I focus on a lot of the smoke-free policies. But what I do know is that in terms of prevalence in Hawaii, like we are the third lowest in the nation. So
Lowest.
of prevalence of smokers, yeah.
So that's good. So on
That's
the one
good.
hand, we have a higher rate of asthma. Blythe, you've got to do something about this.
Yeah.
Okay, and Jill, you say we're the third lowest
We're the
rate
third
for
lowest.
smoking.
Yeah, so.
I'm partially responsible for that. I'm going to tell you
you?
now. I'm going to tell you the story now.
Okay.
You know, my law firm, while I practiced, represented these lots of downtown office buildings, right? And one day a client came to me and he said, one of my office buildings came to me and said, can we stop them from smoking here in the building? I said, yes, we can. We'll issue regulations, building regulations.
Yeah.
We'll tell them to stop. And as soon as we did that, there were a couple of lawyers arguing about it.
Yes.
One lawyer tenant wanted, he said, my staff likes to smoke. Another one says, I don't care what he says. My staff doesn't want any smoke. So we had two lawyers arguing. Ultimately, we favored the one who didn't want smoking. And that building turned into a no smoking building, and then another one, and then another one.
Yes.
And then the city council decided no buildings, no downtown buildings. So it was, it was a rolling snowball, and it ultimately resulted in no smoking in the downtown buildings.
Right.
And I'm sitting right next
Thank
to you.
you.
You're sitting right next
I
to
have
me.
to thank you for that.
okay.
Yeah, that's great that you have that story.
Yeah.
We heard stories about that, how it happened incrementally, and now we have, as of 2006, we have our state smoke-free indoor air law, so that covers everything. So that now saves other lawyers, from having to go through that process that you had to go through. So. Yeah,
Well,
that's awesome.
smoking, smoking is something you can control. Asthma is not so easy. Smoking is something where you can stop smoking. It's that easy. And I'd be happy to admit to you that I smoked for 20 years when I was younger, before you were born. Then I gave it up one day, and it stuck. But a lot of people have trouble because it's habit forming, and that's the hardcore, with people. And your job, what, is to get them to stop smoking?
Well, yeah, I mean, that is our goal ultimately. We want to create an environment where, it's easy for people to access services to quit, or that we eliminate smoking and exposure to secondhand smoke where we congregate in places. And so, as a program, we try to do different broad things to help individuals make it easier for them to quit or to not start.
So you both have various techniques to help people, and we're going to talk about that. But before we do, I want to ask you, do we have numbers about the pernicious results of smoking in Hawaii or in the country? Because, everybody knows that tobacco, long-term tobacco use does cause cancer. It's a foreign body in your body. It's not friendly there.
No.
And it's going to, mess up the cell structure, and before you know it, you've got a tumor in your lungs or whatever. So do people understand that? And by the way, is what I said the science? Is that an inescapable conclusion?
Yeah, so smoking does, I think, well, the vast majority of people understand that smoking is bad for you, and or even exposure to secondhand smoke. So people understand that it's harmful, but, and what you said is right, it does cause, I think the main things are, or the most common is that it does cause lung cancer. I think even as a non-smoker, your risk increases by like 20 to 30%. And
20 to 30%?
if you're exposed to secondhand smoke. And even if you've never smoked before in your life. And also for heart disease, it's about 25% your risk increases. But I think probably the most interesting to me is that I think a lot of people don't understand that it triggers heart attacks. So, you know, in cancer and heart disease, that's sort of like a cumulative effect over time. So it's sort of like exposure over time, and then you develop those diseases. But with heart attack, it's almost like a trigger. You know, it's when your bloodstream is exposed to nicotine, it becomes, I guess it makes your platelets in your blood very sticky, and so it's more prone to clotting. So that part is really scary to me. And then also
that could happen anytime, even if you haven't smoked for a long time.
I think if you're somebody that has like a compromised, or, you know, or if you have some sort of cardiac condition or something, it could, you know, really jeopardize your health.
Yeah, you mean like you could fall down dead. Yeah.
You could get I mean, it's possible.
That's a definite compromise.
Yeah.
It ruins your whole day.
It does.
And the day after.
So what is this about secondhand smoke? You know, I mean, if I walk into a room and there's smoking there, and some guy's smoking like on the other side of the room, am I getting secondhand smoke from him all the way 30, 40 feet away?
Yep. So that's actually, I mean, fortunately now in Hawaii, so we're pretty, as relative to the rest of the country, we also have pretty progressive laws. So like, you know, as you mentioned before, now we have a smoke-free indoor air law that covers the entire state. So that basically pertains to any places that are open to the public or that are places of employment. So smoking is not allowed by state law. So
what happens if I smoke anyway? You're going to come for me with a net?
We could, or we could send somebody, yeah. So.
Is that right? I mean, you have penalties.
There are penalties, yeah. The police do enforce that law.
Good.
So, yeah.
Right. Happy to hear that.
Yeah.
If somebody phones in a smoking report, okay. If they want to phone in a smoking report, what's the number?
They would just call the police. I don't know.
Okay.
Or they can call me too. I mean, I do take the complaints from the public, so.
Okay, what's your number? Never mind. We'll discuss this during the break. Okay, so now suppose that person is sitting as far away as Blythe is, you know, let's just, 5 feet or so. Yeah, my exposure to the secondhand smoke is obviously going to be more.
Yeah, you mean as opposed to?
Across the room.
I would say so. Yeah. I mean, you're closer to the source, so.
Okay. So what should I do if I find that Blythe is smoking here?
You mean you're indoors and she's?
What should I? Yeah. I guess I could leave.
You could leave.
That's a reasonable solution.
But yeah, most people would call me. Actually, they can report it to Department of Health, and if it's something persistent and ongoing, we can follow up. The police can, cite a person for smoking, but I think it is a little difficult, because they have to actually catch the person in the act.
Yeah,
so
you don't make friends. No.
No.
If it's a coworker, you're not going to make friends.
No.
Okay, switching now to life at home.
Okay.
This is pretty serious if it happens at home. And it just seems so terribly unfair when you measure these additional risks of people to secondhand smoke, and then you put a child in the victim position there and a parent in the smoker position. That parent is really doing a great disservice to his own flesh and blood.
Yeah.
So how do you stop them from doing that? You knock on the door and say, "Excuse me, the tobacco patrol is here. Open the door."
Yeah, unfortunately, we don't have staff to do that, but that is a really huge problem. I do get, I'd say about 40% of the calls that I receive are about people complaining about their neighbors. And oftentimes, most times, the person calling has severe asthma, or their child has asthma, or they, have, recently had heart surgery or they have cancer
Oy,
or
oy, oy.
something. So it is a problem, unfortunately, and it's hard because it's difficult to tell other people what to do in their own homes. I think in Hawaii too, we have a hard time confronting people, I'd say.
The kids don't have a problem confronting. I mean, I have a vision of a kid who, somehow you've trained this kid in school that secondhand smoke's not so good. He goes home and his father is there smoking, and he says to his father, "Dad, you're smoking, and it's going into my lungs, So will you please, they told me at school, will you please stop smoking?"
Yeah.
Does that work? Can you do that?
The kids are often the best messengers. I think when a kid speaks, it's a lot more compelling than, I've seen kids, provide testimony in court, and it goes, a lot farther sometimes than, a lot of adult testimony. So yeah.
This is one of the reasons I want to be a kid again.
Yeah.
Go around and tell people exactly what's on my mind. Okay, we'll take a break. When we come back, I'd like to talk about the relationship of tobacco and asthma, because we know you let it slip. There is a relationship.
There is.
Yeah. Okay. So that's Blythe Nett over to my far left. She's into asthma. And Jill Tamashiro, she's into tobacco. I don't mean it quite that way, but they try to prevent those things. Here in Hawaii, the state of health, we're talking about health in the home environment. We'll be right back.
Aloha, my name is Miley Scarpino, and I'm the host of the Empower Hour. If you're interested in health, nutrition, fitness, here on the island of Oahu, want to learn more about places to train at or different trainers available, then watch my show on Fridays at 3. We have a great time, and I hope that you'll come join us. Much aloha. Now go get swole.
Aloha, my name is Josh Green. I'm a senator from the Big Island and ER physician. Every other Tuesday, I get to host a show here on the ThinkTech program about healthcare. We call it Healthcare in Hawaii. It's really enjoyable for me to bring other healthcare leaders from around the state to talk about our pressing issues. Hawaii has long been the health state, but we need to keep up the momentum, the inertia, and with your help and with your participation, we can come and share all of the big issues that are pressing day to day. Thanks for joining us every Tuesday, alternating weeks from 2 to 2:45.
Okay, we're back. We're live. We're here with Blythe Nett and Jill Tamashiro talking about asthma and tobacco. And we have first let me ask you a question. Can you describe what a house looks like where there's all this smoking going on? And would you say that a picture is worth 1,000 words?
Yes.
It just so happens.
Oh.
We have a picture.
Great.
Okay, these are some. Why don't you give us a running narrative on this?
Well, I got these pictures from the mainland. We're a part of a listserv, of people that work on smoke-free housing policies, and so this was one of several pictures that circulated, and it showed an apartment that was heavily smoked in, and basically what happens. And I heard other people talk about these types of things where there's, as you can see, just like the outline of photos, and so. Secondhand smoke, this actually brings up the point of third-hand smoke, which is basically the residue left after the smoke. The person stops smoking. So even those,
You mean there's still
stains,
smoke in the air?
well, no, the residue that's left
on
from
the
the
walls.
secondhand smoke, it's still toxic. So, and then it actually mixes with, ambient air particles, and it becomes even more toxic.
It's on the walls and it
So-
comes off the walls.
And so it can, trigger people with asthma. It can still be really harmful.
Did you see that last transition in our little show? Our control engineer, Zuri Bender. Can you do that again, Zuri? I'd like to see what, this is perfect for our show today. Watch this. Everybody watch this. Okay, ready, go. There it is.
That was awesome. Yeah, thank you.
Yeah, thank you, Zuri. It's perfect. We want to make the point. We're making the point.
Right.
Okay, so the third hand, that's really scary because you could go into, a house that doesn't have a smoker. And can you smell it?
Yeah.
The picture that you showed us, we could smell the tobacco.
Yeah, I heard it takes, that brings up another point, which is that it's extremely costly to renovate a place like that, obviously. And like what I heard is that, you can't just paint over it. You either have to rip walls out, or it takes multiple layers of oil-based paint to even try to cover it, and you can still smell it. This is what I've heard from people.
Yeah, it's true. I remember in the old days when they had, I guess they still have it, a smoker room in a hotel versus a non-smoker room, and you could always smell the smoke. It's really awful.
Yeah.
They don't even have smoker rooms anymore, do they? What about Waikiki? You stopping it in Waikiki too?
You know, some of the hotels are just self-electing to be smoke-free. So I don't think all of them are yet.
Yeah, some people have needs.
Yeah, like, you know, but it is a movement. It is happening.
Yeah,
so.
okay. All right, so let's connect the two now. Seems to me, I'm just making a layman's guess, but it seems to me if I smoke a lot, then I'm more likely to have adult onset asthma. Am I right?
Yeah, that's true. You're more likely to have asthma, and what surveillance data also shows is a lot of the kids who have asthma, unfortunately, have parents who still smoke.
Who don't smoke.
Who do smoke.
Who do smoke.
Yeah.
And that
And it can
aggravates
trigger,
the whole
yes,
thing.
yes.
What's it like for a kid to have asthma? That's not so good because if you're a kid, you want to run and jump and play and whatnot, and that requires easy breathing.
It does.
So
You know,
a kid
and
with
so
asthma,
so they're missing school. They're probably having to use a lot of inhaled medications. I think people may have seen there's a nebulizer mask. They may be going to the doctor a lot, and it's just, it's kind of not that fun if you're a kid. It's disruptive.
Yeah. You watch TV these days, and you see these ads for all these kinds of medicines, right? And one of the most prevalent medicine is the medicine about asthma, and other respiratory ailments too. But I always like these ads because they tell you the miraculous thing that the drug can do, especially the breathing stuff, the breathing drug for asthma, and then they give you the list of side effects, which are horrendous.
Well, I mean, for the most part, for people who have, severe or even moderate asthma, the recommendation is to be on an inhaled daily medication. And usually the side effects are not too bad, or at least they're preferable to not being able to breathe. And if they they take their medication regularly as prescribed, then usually they're good.
So you have to tailor the dose and all that.
It's pretty tricky. Not tricky, but you do have to sometimes work with the pediatrician or the physician to make sure that the dosage is right. And I think that's sometimes a little complicated for anyone is, how much are they supposed to take, what time of day, how many puffs? Okay, if I get into trouble, do I need to take more puffs, which puffer? And
you don't want to take too much puffer.
Well, I think if you get into a situation where you're taking your rescue inhaler frequently and it's not helping, then you need additional help.
Yeah.
And so, part of what with asthma, what you should want to see is good self-management education. So patients and parents can understand these things and know how to manage it, so they're not always in the doctor's office, they're not always in the emergency room.
Yeah, for sure.
Yeah.
So how does the puffer work? It de-inflames. It's often a steroid of some kind.
It's usually the daily maintenance medication is usually a steroid that you inhale, and so that works on, as you said, the inflammation. So over time, it keeps the inflammation down. Now, there's also rescue medications, which is so if, I go for a run or I'm outside on a foggy day and I need a little extra boost, that will open up the airways as well. So they kind of work on two different mechanisms.
I don't know the answer to this, but suppose I abide by my doctor's instructions, I do it just right. Okay, am I going to not need that medicine anymore?
Hopefully
Will there
not.
come a day when
You shouldn't.
I'm cured of asthma?
Probably not. Probably not. We usually expect that it's chronic, and that you're always going to need to take something to control it. But people are different, and so maybe you change your environment, and
Well, suppose I go to Arizona where it's not humid at all.
maybe.
That might help.
Maybe.
No, it's not clear though.
It's not clear, and again, everyone has different triggers. I don't think people are allergic to cactus, but you might there might be pollen or something in Arizona that doesn't agree with you.
Yeah, right, which would exacerbate it. Yeah. So, what does your program include in terms of going out there into the community and finding people who could use some help and helping them. What does it do?
So we try to build a kind of a system of care in the state, and so some of that is working within the healthcare system, so with providers, with community health centers, making sure that, you know, they're kind of up to date on management guidelines, that they're providing the right kind of treatment. We also work a lot with community partners like the American Lung Association, because they're kind of a big provider of what we call self-management education. So in schools or in the community, they'll teach people all about their inhalers, all about their triggers, all about how to manage their asthma. And then we also partner with organizations like the Tobacco Program to try and kind of see if there are ways to reduce the environmental exposures in whatever way we can, whether that's through smoke-free policies or other types of work.
Okay, so do you come to the home?
No, our program, we don't, there's only 2 of us, and we're in the health department, and we don't do direct service like that, but we try to work with organizations that do, such as the community health centers and American Lung Association.
Okay, how many people are you able to reach that way? Do you have stats on it?
Well, it depends. We have different programs. A couple years ago, we did do one with the 3 community health centers, and we reached a couple hundred families. But that takes, you know, it takes kind of a lot of resources going into the home and helping people. While it's definitely an evidence-based program and it definitely has a great impact on people, it takes a lot of energy.
What is evidence-based?
So evidence-based means that, you know, scientists and public health experts, and not just here in Hawaii, but across the country, have, you know, looked at these programs and decided, yes, that those programs really do make an impact that we can quantify. So, I mean, there's a lot of things that we would probably want to see done because they seem like good ideas, but evidence-based programs are the ones that have been proven to make an impact.
And it's dynamic, because it's always being proven and reproven.
Yes.
And so it's shaped as you go forward based on your experience or the national experience in the field.
Yes.
That's great.
And home-based interventions fall under that.
Are there metrics to determine how successful you are?
As a program, or sure. I mean, we try to look at things like how many people are hospitalized from asthma, and whether that's going up or down. We've been fortunate that this has actually been going down in our state for the last several years. You know, we kind of don't have a way to impact the number of people who have asthma, so we don't really look at prevalence so much as a measure. But again, we are looking at kind of, are we reducing costs? Are we getting more people access to the resources that they need? Things like that.
Yeah. You know, I've heard also my TV experience is rich and varied. And the reason is my puppy likes to watch TV, so
Sure.
I just sit next to her and we watch together. A family that watches together. So COPD, a lot of ads about COPD and the various medicines. So is there a sort of a transition from asthma to other things like COPD? If you're compromised by asthma, do you have the risk of having something worse than asthma in terms of respiratory ailments?
I think it's possible, but I don't know that necessarily having asthma means you're going to have COPD. I'm not.
What does this stand for?
Chronic obstructive pulmonary disease.
Thank you. Good answer.
Which again is similar to asthma, I think, in terms of how the experience of it, right? People have trouble breathing and things like that. And we work a little bit with the folks that work on COPD, but it's a little separate from what we do, just I think because they're not necessarily hand in hand.
Okay, we're going to take a short break again, Blythe. We're going to learn about other ways that people get, asthma with some photos. We're going to take a look at. People will be fully educated in the matter. That's Blythe Nett. She covers asthma for the Department of Health, and Jill Tamashiro, she covers tobacco for the Department of Health. And we're talking about health in the home environment here on Hawaii, the state of health. We'll be right back.
Aloha, I'm Kili'i Akina, president of the Grassroot Institute and host on Ehana Kako, a weekly program on the ThinkTech Hawaii broadcast network. Ehana Kako means let's work together. Think of the sad alternative, let's not work together. Here in Hawaii, with all of our diversity and the richness of the people, it's important for us to come together around issues on the basis of what's right and what's good and what's going to serve the common good. And that's what we try to do at Ehana Kako. Every week, we interview movers and shakers, people in government, business, and other sectors of society to talk about how to create together a better government, economy, a better world here in Hawaii that can bless the rest of the world. I thank you for your attention to ThinkTech Hawaii, and we look forward to seeing you every Monday, 2 to 3 p.m. on the ThinkTech Hawaii Broadcast Network. We're Ehana Kako, and we wish you well. Aloha.
Okay, we're back, we're live, we're here. We're having a lovely afternoon on a given Tuesday with Blythe, Nett, and Jill Tamashiro of the State Department of Health here on Hawaii. The state of health, we're talking about health in the home environment, especially about asthma and tobacco. So let's look at some pictures and see how they affect us. Okay, what is that, Blythe? Tell us, give us a
So
running
those
discussion.
are, you know, cleaners or other products somebody might have in their garage. And so for a lot of people, they contain pretty harsh chemicals, and for certain people with asthma, they might be sensitive to that. Now, you know, to the extent that you can, we sort of encourage people to use more non-toxic cleaners, or at least keep the really bad stuff, you know, put away where you're not breathing it every day.
So when you have a toxic cleaner, it's going to have an effect
Yeah,
on
some
you.
people, you know, it's going to irritate and potentially bring on an exacerbation.
So any kind of toxic,
Sure, yeah.
if you breathe it in, it's like the American Lung Association is very interested in that.
Yes.
Yeah. Okay, what else? I got more. I want more.
Ooh,
That's the one I
cockroaches.
wanted. This is really special. What in the world is this and why?
So if you live in Hawaii, you're probably more than familiar with these little brown guys. They're cockroaches, and most of us, you know, have to deal with them every so often. But for people with asthma, it can actually trigger exacerbations. If you really want to know, kind of when they shed their skin, or if they leave droppings behind, those are the specific parts of the cockroach that are troublesome.
They have chemicals in them,
They
organic
have,
chemicals
yes,
or something.
the stuff, it just can impact people's breathing. And
I
so,
don't have asthma, and I think it would do the same thing.
Yeah. So, you know, so for cockroaches, what we try, you know, again, going back to, you don't want to use as much as possible those really harsh sprays and those bombs. But the sticky traps can be a good idea. And then also kind of preventive measures, making sure your house is clean. You put food and water that the cockroaches will be attracted to, you know, kind of keep them off your counters, keep your kitchen clean, keep your trash can sealed, things like that. Just can, for all of us, can help us cut down on our cockroach.
What about ordinary dust?
Oh yes, dust. So I don't know if we have a picture of a dust mite. Well, a dust, it looks like a,
What is it? It must be very small.
it's very tiny, and it just looks like a little insect that we can't see. But for a lot of people who are allergic to dust, it's a big problem. And so things like your mattresses, your pillows, if your child has a lot of stuffed animals, those are things that can collect dust. And so, you know, you can't, what we recommend is for people to vacuum frequently, make sure they're laundering sheets and bedding on a regular basis, preferably in really hot water. If you go to, you know, Walmart or wherever, you can buy vinyl or plastic mattress and pillowcase covers, and those will provide a barrier between where the dust mites live and where they can get into your breathing passages.
Can we have another photo?
I don't know if we have a dust mite.
Condo.
Condos.
Life in Hawaii Nei. So I guess the question, it is a condo and there's a freestanding, you know, home, single family home. Is there a difference for this discussion?
I think not necessarily. I mean, I think, you know, if you're in a more closely packed together, you know, cockroaches may be a bigger concern, or maybe secondhand smoke. But I think for the most part, the discussion is the same. I mean, you're still kind of trying to do similar strategies and similar conversations.
You know, in my law career, which is over now, but my law career, I entered people's homes once in a while, you know, who I didn't know and everything, and I had a chance to look around at how the public lives. And it's really sometimes amazing how they live, because they don't clean the dust, they don't clean anything sometimes. And the question I put to you is, I mean, that must be a serious challenge here. Because by definition, if you have a home that nobody's cleaned in 5 or 10 years, you're going to have problems. You're going to have respiratory problems. Is that right? So it comes down to the basic thing about keeping your home clean. It's not an option. It's important. Right?
It's important, and I think too, it's partly a matter of education. I think sometimes people don't know, or they, you know, unless it turns out that this is something that's really affecting your health, maybe they don't prioritize it as high. But I also think sometimes, you know, people have competing priorities for their time, like anything else, and so.
Yeah, I think that goes on the issue of health in general. Sometimes they don't care about their own health. It's not a priority. What about black mold? We have a photograph of black mold. Let's take a look at that.
Yay,
Whoa.
mold.
It sounds so awful.
We're showing all kinds of pretty pictures today. So yeah, and so mold is another trigger for a lot of people. And I think what's hard about mold is, you know, if it's really deep in your walls, I mean, it's not a cheap or easy fix to get rid of it.
But it's deadly.
But it's really bad for you. Yeah.
It's
I mean,
toxic.
you can kind of spray the bleach, but again, sometimes the remediation can be
Yeah.
a
It's
challenge.
like poison.
Yeah.
And you can get sick from it. Yeah.
Yeah. Get sick looking at the pictures.
Yeah, that's true. Look at that. You know, but the interesting thing is that you see that once in a while
You do.
in homes, and I guess people don't realize that this is bad.
Yeah.
If you see this in a home, something really bad is going on, and it's going to affect the health of the people who live there or visit, for that matter. Yeah. Okay, let's shift back to tobacco. back to Tobacco Road. So, what kind of programs do you have going, Jill?
Well, so speaking about the home, that's one of our big programs right now that we're focusing on is with public housing. So last year in 2014, the state legislature passed a law to require that about 80 properties, public housing properties in the state prohibit smoking. So we've had a really good partnership, I think, with the Hawaii Public Housing Authority and with our asthma program, as well as some of our community partners like the Coalition for Tobacco-Free Hawaii. We want to work together to help the residents there at public housing just make healthier lifestyle changes. So, of course, we focus, my program focuses on secondhand smoke exposure, but we really want to engage the community in just being more mindful about health in general.
So how do you do that? Well, I mean, it's an educational process, right? You're going to reach them, you're going to have the moment to talk to them, and you have to say whatever you need to say to change the way they conduct themselves. Yeah.
Yeah. So it's it's a long-term process. It's not something we plan to do overnight. Right now, we are really fortunate to partner with our public health nurses. They already go into the communities. They have relationships with, people that live in public housing, with the managers, and so forth. And so they are really helping us.
Is that a picture of something we should?
No, it's just to show the single-family homes and also in public health we use the term multi-unit housing a lot. So there's all different types of structures in public housing.
What brings a nurse, a public health nurse, into say a public housing project?
Just recently we've been working very closely with them. I mean, having a lot of conversations, and it seems like they do quite the breadth. I mean, they address all kinds of issues. So I think they really respond to what the community needs are. Of course, there's pressing things that are sort of problems that a lot of people deal with, like obesity, and of course secondhand smoke or asthma is a huge issue. And so depending on each particular community is different, so I think they'll respond to that given community.
So that's the point of contact, the public health nurse. Yeah? Nurses are occupying a different role than they did years ago, seems to me. And public health nurses work for the State Department of Health?
Yep.
They're different than a nurse you would find, say, in a hospital.
Yes.
And they're like the extension program. They go out and talk to people and try to find out health conditions that need advice and consultation.
Yeah, I think, I mean, you know, I'm obviously not a nurse, but
No, don't say obvious. You could have been a nurse.
oh,
Maybe you still can be a nurse. What do you guys train? Let me take a moment and ask. What's your training?
for me, I have a background in public health, so that is the basis for
That's a reasonable reason to work for the Department of Health.
Makes
What
sense.
about you, Blythe?
Yeah, I also have a public health
From
degree.
UH?
Hers is?
I'm UH, yeah.
Okay, you're not.
No.
Okay, all right, okay. What do you study in the public health program?
Well,
You study medicine, I guess, and you probably.
well,
Sort of. You study epidemiology, so which is kind of like not necessarily specific diseases, but how they're distributed in a population. And then there's some statistics that go along with that. And then they you get kind of training in different things like environmental health and sort of more behavioral health or social things. Is that about it? It's been a long time since I've been in school.
yeah, policy. There's I think that about covers. I may have
when you
been
talk
missing
about
one.
public health, the operative word is, well, it's not only health, it's public.
Yeah.
You know, it's you know what it's like? It's like that whole issue about the the polio vaccine on the mainland. And there's some people for religious reasons they don't want to take they want their kids to take polio, but
Yeah,
it's not their choice. It's the community's choice, and nobody wants polio to affect the other kids. And so California recently, I don't know if it's passed, but it's about to be passed, a statute that says there are no
Have to get-
exemptions.
yeah.
Everybody got to take the vaccine.
Yeah,
So it's the same thing here. It's not so much the individual, although you want to see everybody healthy. It's the community.
Yeah.
Yeah, it's interesting because those are the types of controversial things that sometimes we deal with. Like, with smoking, a lot of people feel like it's their individual right, but,
I don't remember that from the Constitution myself. Yeah.
it's not in
No,
there.
it's
Yeah, no. But yeah, so there's a lot of individual versus what's good for the general public. So those are.
Exactly, and that was our analysis when we started,
Mm-hmm.
excluding smoking from the downtown office buildings. So you're both, trying to hit this on the individual level, but also on a public health level.
Yeah.
And the question is, what are your obstacles? Where do you run into trouble? Where do you get frustrated? Where do your programs get stuck? Help me with that.
I'll take that one for sure. Well, so I guess for me, there's a lot of challenges. I mean, working in smoke-free policies is very interesting because it's very personal. Smoking is a very personal choice for a lot of people, and we're working on changing social norms, which is something that takes some time and a lot of pushback. We expect a lot of pushback. So, and then we have a very active tobacco industry that's pushing hard against that too. So that's that's one of our big challenges amongst many. So
Absolutely, there's a challenge. Okay, Blythe, if you recall, Jill said that she learned a lot from you today.
Okay.
So what did you learn from her today?
Well, I learned a lot about the third-hand smoke transfer.
Yes.
And then also that picture with the yellow nicotine-stained walls.
That was really special.
Oh, yes, I will remember that.
I had to contribute my gross picture too.
Yeah.
So,
Thank you very much for that.
You're welcome. You're welcome.
It's Blythe Nett and Jill Tamashiro dealing in asthma and tobacco prevention at the State Department of Health. And we've had the pleasure of their company here for a while, here on Hawaii, the State of Health, talking about health in the home environment. Thank you, ladies.
Thank
Thank
you.
you.